to our care, welcome to our care home echo. Next slide. And yes, we have the idea of putting our names in the chat box, right? So this is free continuing education credits from the convenience of your own home. Ask all the questions you want, and we're going to all learn from each other. We thank our sponsors and our supporters here on the left side, including Aloha Care and United Healthcare. Thanks for this series. Next slide. And if we share any case presentations, let's not share patient names or birth dates. Your questions can be anonymous. You can put your questions in the chat box and direct them and have them directly go to Rita Bell Fernandez, and she'll be like monitoring the chat box and pulling the questions. And nobody else needs to know who the question comes from. Or if you don't mind, you can just unmute and ask your question. This is a safe learning environment. And we want to just make sure that you know that the ECHO discussions are not official doctor consults. It's only for teaching purposes. Next slide. You know how to use the chat box to enter your name and others joining you in the same screen today, and press enter. So yes, everybody's doing that. I love it. Thank you. You guys got it. And of course, there's that mute button to keep it muted if you're not speaking, and unmute to speak. Next slide. And this month we're on, in August, we are talking about mobility. Next slide. And to receive your certificates of attendance, after you've registered today, at the end of the session, there will be a link for the evaluation that Michaela will put up. So make sure you take care of that before you leave. Next slide. And here we go with introductions. I'm the course director for the Echo Geriatrics Clinic. And we have Juanette here, I'm sure. And from the Care Home Operator Association, and Maribel Tan. Juliana, are you here?
Hi, team.
Hi.
Good to see everybody today.
Great. And Layla, are you here from United Healthcare? Not sure. Okay, next slide. And then, of course, very, very importantly, we have our guest speakers. We have Susie Neufeld, who is the owner of PT Works, and she's going to be sharing with us today. And Dr. Rita Bell Fernandez, who is also an associate professor with the Department of Geriatric Medicine, and she will help facilitate today's session. Next slide. So before you started, we always talk a little bit about wellness, because life is stressful, right? And so the wellness tip for this month is finding serenity. And what is serenity? It's a state of being calm and peaceful. So I have a friend who shared this with me. This is actually like a little comic book thing. It's doing what matters in times of stress, an illustrated guide, right? So how do you find peace and calm when things are crazy? And and so this kind of walks you through noticing how you respond to stress and create healthier responses to stress. So this is the name and the source. And the next slide, we're going to have the link to that. And of course, it's also in the resources section of our Care Home Echo website. You can find that there. But next slide. But I just wanted to show you, this is, it's like 136 pages, but this is what each of the pages look like. So it's really, really short and sweet, right? This guy says, when something is on a hook, it cannot get away. The hook traps it. In the same way, we can get hooked by our difficult thoughts and feelings. One moment we may be playing with children, and the next moment we are hooked by difficult thoughts and feelings. Right, next slide. Yeah, and then, jump ahead here, right? This person is getting hooked by the stressful situation, and difficult thoughts and feelings hook us, and we are pulled away from our values. Next slide. And so these are the thoughts you have when you're getting pulled away, like, I give up, it's too hard. it's his fault, I'm crazy, and then you start going all the stressful reactions. So before getting to these stressful reactions, we have to find ways to react differently. So next slide. So anyway, that's just to give you a little flavor. It's like 136 pages, but it's a really fun read, and you don't have to do it all at once. It's just step by step, and it tells you how to practice certain things, and it's kind of fun. So I just throw it out there, give it a try, and I'll put the link in the chat box for you to click on if you want to take a look at it, or you can just go to the website and get the resource. So I hope you have fun with that. Next slide. Okay, just a little bit about COVID. Want to make sure people aren't confused by the all recent changes going on. Okay, so as you know, yeah, it was like front page on the newspaper, right? The new CDC guidance, and we're going to relax things in schools, right? So that, if they test positive, we just quarantine for 5 days, return to school at day 6, as long as symptoms are improving and fever is gone. No need for negative tests, right? Just wear a mask till day 10. And if you have a negative test, they can still stay in their classrooms and get tested on day 5, but wear a mask for 10 days after indoor exposure. Because, they believe that for children, right, the best place for children is in the classroom if it can be done safely. But I just want to say something, because this, we are not the school system. We are actually a healthcare system, right? And we are taking care of older, vulnerable adults. And so this does not apply to us. And everybody else is going to urge you, and all the patients and their families are going to say, oh, yes, we should go by the new CDC rules. It's different. Next slide. The other thing I wanted to highlight is that when that news came out, there was another one that came out. The FDA put out new guidance about COVID antigen testing, and somehow it got kind of buried in there and nobody really saw it. But I just wanted to highlight this as well, is that on the same day it came out, the FDA guidance, at-home COVID antigen tests, right? They're fast and they're convenient, but they have missed or false negative results. And so some people can unknowingly spread the virus to others. So if you have symptoms and the first test is negative, you should test it again after 48 hours. And then you should do it for at least 2 tests. And if the second test is negative and you still have symptoms and you're still concerned, you should get the PCR test, because there are false negative results out there. And if you don't have COVID symptoms but have been exposed to COVID, you should repeat the test every 48 hours for a total of at least 3 tests. So if the third test is negative and you're still concerned, you should try getting the PCR test. So I just wanted to highlight that out there, because we should probably be using more tests than we are in order to keep this virus from spreading. Next slide. And this is just a reminder that nursing home, and I would put care homes in the same category, nursing home guidance has not changed. And the relaxed guidance does not apply to our care settings. So if our residents test positive, we should start COVID treatment and quarantine for 10 days. For facilities, anytime there is a positive test in either the staff or the residents, you need to expand screening to all residents and caregivers as part of an outbreak response, regardless of vaccination status. And if the test is negative, we should retest it again every 3 to 7 days until there are no new infections identified for at least 14 days. And for healthcare personnel, if you get a positive test, just restrict work for 10 days or 7 days with a negative test, and if symptoms are improving. And if you have a negative antigen test, there are no work restrictions, but as we said, there could be false negatives, so retest it. I would retest it every 48 hours for at least 3. So that's that on COVID updates. And if you have any questions, speak up, and we'll give you like 2 minutes. All right, everything okay? Okay, and I'll let Susie go ahead and share screen. And yeah, if you still have questions, you can still put it in the chat box afterwards and we can get to them later. Okay, thank you so much.
Can you hear me? Okay, you can hear me. Okay, great. Hi, everybody. Thank you for coming to the presentation. So my name is Susie Neufeld. I'm a physical therapist and I'm the owner of PT Works. So basically what my company does, I've had my company for about 13 years and we staff, I staff at about 18 different assisted living homes and care homes throughout the island. So I have a physical therapist, occupational therapist, and speech therapy that is assigned to various assisted living homes and care homes. And I personally have been a physical therapist for 25 years now, and I have been just strictly working in geriatrics for the past 13 years. So geriatrics is definitely my passion, and I'm really excited to talk to you today about physical therapy. And our topic is maintaining and maximizing function. So let's go ahead and get started. So first of all, I just want to talk to you about, what is a physical therapist? What do we do, and how do we address mobility and ADL deficits? Well, we have many different treatment techniques that we use to just help, maintain and maximize that person's ability to be mobile. And we do it through strength training programs, neuromuscular reeducation, at the care homes and ALFs, a lot of balance training, fall prevention. We also do a lot of range of motion, flexibility activities. We also work with patients on pain management techniques, really to help minimize the use of, pain medicine. So we do, we're trained in pain management techniques through soft tissue mobilization, range of motion. We do home safety assessments and a lot of patient and caregiver education training. So that is a treatment approach that we use. But due to insurance restrictions, physical therapists have a limited time with the patients. So a key treatment approach is to provide meaningful functional mobility tasks and exercises that can be carried out by the patient or caregiver once that patient has been discharged. So that, again, one of my favorite things to do is to provide teaching. I love to teach. I love to teach the patients. I love to teach the caregivers. So some of the goals of geriatric physical therapy is, keeping the client active. We want to prevent deconditioning. We want to slow or decrease muscle atrophy. That's like muscle weakness. Fall prevention. We want to prevent those falls happening in the homes. We want to maintain the highest functional level as possible. And then we want to create a partnership with the patient and the caregivers. So, we are a team, working for the same goal. And that goal is to keep the client active, mobile, and again, to prevent falls. So our job as a physical therapist is to help create that partnership and educate everyone involved, in the care of the client. So again, we do this by educating the caregivers on the patient's, functional level, creating a home exercise programs that are realistic, realistic walking programs, and functional mobility activities that can be carried out by the patient, or by the caregivers as well. So like I can get a patient up and moving, that's not a problem. I can get in there, I can work with that patient for a month to 2 months. But if nothing gets carried over once that patient is discharged, then that patient will go right back to that functional level that they were, when they first started PT. And this is why I believe that a partnership between the patient, the caregivers, and the physical therapist is just so important. So I'm sure you guys have all heard the statement, if you don't move it, you lose it. So this is very true for the elderly. So let's look at the scientific evidence of the benefits of exercise with older adults. So there is strong evidence that compared to less active men and women, older adults who are physically active, they have a lower rates of medical issues, healthier body mass, healthier bones, a higher level of like functional health, meaning like they can do their ADLs better, and also better cognitive functioning. So when you look at this, and when you see like just this evidence of like how important it is to exercise and to move it, exercising and staying mobile becomes just even more important as we age. So I love this slide. So we all know how important exercise is, but again, for too long, like us and also elderly people and caregivers who take care of the elderly, we've neglected to take that recommended dose. So again, I love this slide. Exercise is the miracle cure. If exercise were a pill, it would be one of the most cost-effective drugs ever invented. So just think about that. Think about how important exercise and moving is on our bodies, on our elderly clients that we're taking care of. And we all know, I mean, there's strong evidence that shows like the more medication that an elderly person is on, the higher the risk of falls. So this is why we need to make exercise part of the daily plan of care for our patients. So when residents are mobile, they are healthier and happier. Also, for people who are running, who are running like care homes, and who have staff taking care of the residents, when a resident is mobile, when they are moving, it's actually less taxing on the staff as well, when that resident is, mobile and moving. So let's take a look at the effects of immobility in the elderly. And again, if you don't move it, you lose it. This is what happens. Muscle atrophy, muscle weakness, and deconditioning will set in. When you're not moving, okay, our residents are going to become stiffer. They're going to have more contractures, more pain. So again, they don't want to move. And then what happens when they don't move? You have decreased function. Decreased function leads to falls. So falling can have tremendous physical and psychological effects on seniors. So falling leads to head injuries, fractures, death. So even if a senior recovers from a fall, they can be left with the fear of falling again. And that fear of falling can lead to social isolation, so inactivity, decreased functional independence, and also depression. And that chance of a person falling again, once they've had a fall, that chance of them falling again actually increases. And, I've seen it personally, after a fall, like a resident, they change. They don't want to leave like their apartment. They don't want to leave their room. And, again, they can become depressed. I mean, so for you and I, like a fall might, it might, it might not be a big deal. But when an elderly person falls, they don't have that balance reaction and they have those traumatic falls. I mean, it really can leave a lasting psychological effect on seniors. So just remember that, like, it's not just a physical effect, it is also a psychological effect. And I've seen it. All right, so we've talked about what is a physical, what does physical therapy do, our goals of physical therapy. We've talked about the why it's important to exercise, the effects of immobility. So now what I want to do is discuss the recommended exercise dosage, that prescription needed to help keep our residents active and healthy. So the CDC, the NIH, AMA recommendation.
Close it.
Oh. So
Please mute.
Okay, so the CDC, the NIH, and the AMA, their recommendations for exercise in older adults includes 150 minutes of moderate intensity aerobic activity. And when you look at that number, you're like, what, 150? But let's break that down, okay? So 150 minutes of a moderate intensity aerobic activity would be about 30 minutes a day, 5 times a week. And actually, it is okay to break up that activity into 10-minute bouts. So you don't have to do 30 minutes. It is okay to do, 3 10-minute bouts of moderate intensity exercise throughout the week or throughout the day. Also, what's really important as well is muscle strengthening activities. So muscle strengthening would be 2 or more days a week. So our job as a physical therapist is really to develop a realistic exercise and mobility program that can be carried out, by the patient or caregivers. And this really is a general guideline that I actually use. And even when we are setting like our frequency and duration, like when a patient is having skilled physical therapy, we will see them at minimum starting out 2 times a week, because we really want to work on strengthening exercises and those balance reactions. And most of our patients, we do see them, 45 minutes to an hour, because again, we want to get that moderate intensity, aerobic work in there as well and start conditioning them. So I know you're probably looking at the slide. All of you guys are looking at the slide and you're going, this is just not realistic, but it really can be realistic. Aerobic activities can be as simple as a walking program. And a lot of times, that's what I will prescribe, after, when the resident is getting ready, when we're working on home exercise program, when I'm educating the patient, when I'm educating the staff, a lot of times, I'll just say walk. They've just got to walk, don't push them. I know it's so much easier to just, and it's faster to push them in a wheelchair, but ultimately in the end, if you don't get them up, if they're not mobile and they're just being pushed in a wheelchair, in the end, it is going to be harder for your staff. Because I got to tell you, I see the decline in a resident. I can see it very quickly. Like once they stop walking, that decline is very significant and very fast. And then ultimately it's harder on the staff. So benefits of a walking program. I think we all know this, there's an increased likelihood of staying independent, improve aerobic capacity, that's improved conditioning, improved activities of daily living. Believe it or not, it actually, when a person is walking, when they're up and mobile, it's actually easier for a resident to perform ADLs, like showering, like dressing, actually even eating. And also there's a decreased risk of falls. So what I like to do is, like, and when I'm working with my patients, like just for me saying, okay, well, you have to walk 50 feet, 3 times a day, or 150 feet, daily. Well, if someone hears that, like, that's really meaningless. Like, that's just not like, that's not a, that might not be realistic, like, or a realistic way to like get a person motivated to walk. Okay. So find out what motivates the resident, and a lot of times I start small, and I'll tell my resident, or I'll tell my patient, like, okay, so I want you to first, like, I want you to walk from the shower, from like your bed to your shower, or walk from the bedroom to the dining room for every meal. Walk from the car to your doctor's appointment. So you make the walking meaningful. In care homes, I've been to some care, worked in some care homes, and the staff will take like a resident out, just to get the mail. I mean, how meaningful is that? I think it's fabulous. Like, you take a resident out, let's go and get the mail at the mailbox. I've seen at some care homes where the staff will, they have to go to Long's for something to get a prescription. They'll take a resident with them, who is more mobile, to go to that Long's trip. Go on outings. One of my favorite activities, it's and this is done in a day health facility that we go to. It's called the Kaholo program. And so every day after lunch, everybody gets up and they are walked. Not all at the same time, because again, it depends on like just that, how much assist a person needs. But for that 45 minutes after lunch, residents are walked about 300 feet, around the center. And it's just what a wonderful program it is. I really, really like it. So encourage your staff, to walk the residents. And I can tell you will see the benefits, from a walking program. Okay. How do we get a person to walk? And again, this is where physical therapists, this is where we come in. And when we're working with a patient, we're going to educate the staff, like, okay, well, this is how we facilitate weight shifting. This is how we facilitate, an increased stride, or how we facilitate, getting that person looking up. So a lot of that, talk to the physical therapist that's coming into the homes, and learn from those physical therapists. Again, we love to teach. We love to see carryover. But some cues for safe and effective walking is, telling that resident, look up, take big steps, open up your feet, keep that walker in front of you. So, and I do that, I do it very encouraging and positive, and I use my hands as cues, just to help get that resident to, to have a more efficient gait pattern. So just a few side notes, like, you really want to make sure that walker doesn't get pushed out too far in front of the resident. So you want to have that control. So a lot of times what I will do is I'll just stop the resident, I will hold the walker, and then I will just guide them, up to the walker. So they're within that walker frame. I don't like when I feel like they're just way out, that walker's way out in front of them. I don't feel like I have control, and I know the resident doesn't feel like they have control. And then also just a rule of thumb with like the walker height, you want the correct walker height. You don't want to have that walker you don't want that resident to have their elbows bent too much. You want the elbows to be about 10 degrees of bent at 10 degrees of elbow flexion. Or you want the like this part of the hand to like come right down to that walker hand rest. And the reason why is it's because we're just more at a mechanical advantage in 10 degrees of flexion versus up here, way up here. What will naturally happen, the resident will like, they'll shove their hands way out in front of them because mechanically it's just so much easier to push like this than like this. So I always encourage my patients to attend group exercises as well. So hopefully, you know, like the homes, you guys do have like group programs. You know, group exercise can be a strength program, it can be aerobic, or it can be a combination of both. And I just love this drumming class. So it's super easy to create this class in any care home or nursing home. And I actually am seeing this this class being done a lot in different elderly care settings. So I want to show you guys a video. This one doesn't work, so I'm going to have to change over here. Is it right here? Oh, here it is. Yes. Okay.
Here we go. It's 1, 2, 1, 2, 3. You get your heart rate up. You get hot. 1, 2, 1, 2, 3. You don't have to know how to drum. This has nothing to do with drumming skills. It has nothing to do with knowing how to, however Ringo Starr beats his drums. It has nothing to do with that. Nothing. 4, 3. Reach. Things don't work like they did when we were in our 20s or 30s or 40s. 3, 2, reach. The only thing I can say is if you don't use it, you are going to lose the ability. Oh, don't we sound professional? Keep it center. 4, 3, 2, here we go. Keeping our upper body strong to push us up out of chairs, to help us lift things. I mean, you know, it's part of staying alive.
Fun. I mean, you're just laughing, you know, the music is really important. She picks out great music.
3, 2, again.
I would recommend it to anybody. I find that it's much more strenuous than it looks.
2, and rest.
A lot of fun, for one thing. I have to have fun when I exercises or I don't do it. And that's the main thing for me, is having a good time.
It's down and up, down, up, down, up, down, up.
It's such a neat class. And I love this video because I love what each of those women were saying. You know, it's, if you don't use it, you move it. They were talking about like how fun it is. And, you know, the exercise, you know, if you are doing a group exercise class, make it fun. Use good music. Use appropriate music as well. Every once in a while, I'll see group exercise classes and, you know, they're putting on music that's like Nicki Minaj or, you know, music like that my kids listen to. But, you know, we always want to make sure like the music is really age appropriate. So music like Frank Sinatra, the big band era, like those are that at the residents that you have now, that's the music that they connect with. So make sure like when you are doing your group exercise classes that you do have, you know, appropriate music. Okay, so let's just talk about, you know, just the different exercises and balance and flexibility exercises that we, like physical therapists, like will typically you know, give. And like I said, I don't like to give a ton of exercises. I like to give meaningful exercises, realistic exercises. I mean, I understand, like, you know, if a care home provider, you know, gets like a packet like this of like, you know, 30 different exercises for a patient to do, it's unrealistic. So what are they going to do? They're just going to toss it aside because it's too much. So again, you know, I really like to give out those like very realistic, simple exercises. And so we're going to start with the strength exercises. You guys all got there's a handout of the different exercises, which I feel are like kind of like the key exercises that should be done, you know, with our residents. But let's just back up a little bit. But so strength specific exercises, it could be chair yoga, seated tai chi, lifting weights, working with those resistive bands, you know, body weight exercises. And just a few things, just a few like tips, you know, the exercises, you know, choose, if it's a chair-based exercise, choose a very stable chair so they don't fall over. Make sure wheels are locked if they're in a wheelchair. And, you know, if you are going to be using a video for like group exercise, make sure the video is at the patient's level. Like sometimes I just see these like, I'll see, you know, I'll walk into like a care home or a nursing home or ALF, and, you know, there's an exercise video on, you know, it's very fast paced. I just see like the residents just sitting there, and then I see, you know, I'll see like the staff like not really engaging. So just make sure that the videos, you know, are appropriate, they are slow, simple, and have the staff, like make sure the staff is actually doing the exercises or they're with the resident and that they are helping to cue them and guide them, you know, with the video exercises. Movement should be slow and deliberate. You know, you don't want to be, you know, just don't want to just be doing it just to do it. It's a slow, deliberate movement. And just remember, you know, that again, let's go back to that exercise prescription. We want to do, you know, we want to do 30 minutes of moderate intensity, you know, aerobic exercise, which can be like that walking. And it's okay to do it in 10-minute spurts. And strength specific exercises 2 days a week. So again, just keep that exercise prescription in mind, you know, when you are, you know, working with residents. So here are the exercises that I really love, that I think are just kind of the key exercises, you know, for strengthening. Sit to stand. I love sit to stand. If somebody said, okay, you can only give one exercise to a patient, I would do sit to stands, because it really does it. It's working on all those different muscle groups, you know, the trunk, the leg muscles. You have to push with your hands. It's also a balance exercise too, because once you get up, you let go, and there is a balance component in that. So if somebody can't do like just a full sit to stand, doing like mini squats, and all this is in here. It's hard for me. If I was with you guys live in person, I'd be showing these exercises to you, like we'd be doing them together. But you have these exercises that you can use for your reference. I also like calf raises. So that is that third one. So that's going up on those toes. Okay, that's working those gastroc and soleus muscles, and those are really good. Those are great muscles that are needed to, you know, just to help with that walking pattern, and to prevent like foot drop, and to prevent like that heel off. Sideways leg lifts. That works on your glutes. Okay, so again, those are great exercises because we have to have nice glute strength in order to maintain like stability as we're walking in our hips. Okay, wall press ups or chair press ups. Okay, wall or chair press ups. Okay, what that's doing is, again, that's working that upper body, and that if you want to have nice upper body strength in order to be able to do that sit to stand from the toilet, from the bed, from a chair. And also bicep curls. I like bicep curls. They're easy to do. And again, we want to have nice upper body strength in order for us to be able to do those transfers, to lift up, to be able to walk. Balance is an important exercise and an important exercise, and also an important component of fall prevention as well. And a lot of like what I do, with my patients is I work a lot on balance reactions, balance strategies, to help prevent those falls, because we want to increase those balance reactions. We want to increase that stepping ability, if a person does, lose their balance. So again, balance should be part of a resident's routine, a group program or individual, exercises. The exercises that I really like, again, they're all in this handout that I gave you. I tried to make them really simple. Like we just have like a side step. So it's basically side step together, side step together. This one is a grapevine. So again, and it just depends on your residents, balance ability and their stability. So, you can have them hold on to their walker, or have them hold on to stand by a wall. But it's just basically, it's cross the foot over and back, over and back. And then you do it with the other side as well. Heel toe walking, just basically that's a little bit harder, for an elderly person to do a heel toe walk. They might not necessarily be able to get that perfect heel toe, but that's okay. What we'll have them try to do is go, okay, well, we want one foot here, and then try to bring your foot, tandem. But if you can't, that's okay. Just that motion or that movement of one foot in front of the other and trying to hold that balance is fine. One-legged stance, again, a super easy balance exercises. That's working that proprioceptive system in the ankle and balance system, to help prevent falls. And again, you can have them hold on to a walker, to the wall, to a chair, and just try to maintain. And again, if they can't do it perfect, that's okay. A lot of my residents or patients, they can't, sometimes they can maybe do one or 2 seconds, but that's okay. I don't expect perfection. I just want them to try to do the movement. If you have the ability, if you have little steps, in your home, doing a step up, again, that's also a great strength exercise too. That's working on the quads, the glutes. So step up, that's a great one. Okay, and lastly is flexibility. So again, I am a big believer in touching a patient. Rarely do I would I just work with a patient without, addressing flexibility, working on, their soft tissue mobility, working on their posture, decreasing contractures, working on their hip mobility. So I really do think stretching and, working with that patient on maintaining flexibility is very important. Again, I'm also realistic, as we age, we're going to go forward. We're going to be in that flex position. Again, I don't expect perfection. I don't expect, perfect upright posture. But what I want to do is I want to see, okay, well, what is their available mobility? And I want to be able to stretch them, and I want to be able to show them or the caregivers okay, this is what they can do. This is how much they can move. And let's maintain that, through the stretching exercises. it also feels really good too. I mean, have you guys like, when you guys sit all day long, you know, like, what do we naturally do? We stretch, you know? So just think about it with like, you know, a person who's like, you know, just is sitting for a long time. You know, an elderly person, they're going to need like that stretching, that mobility. So I just think it's really important to also, you know, have a stretching program in your homes as well. Lots of different stretches. We've got neck stretches, you know, just looking up again, because we're always kind of in this forward motion like this, you know, this forward position, looking up, reversing, you know, that position that that resident is constantly in can be helpful. You know, upper trap stretches. And this is good for not just elderly people, but it's good for everybody of all ages. We should all be stretching. We should all like make sure that we are, you know, flexible. Also, if the resident, you know, is able to stand up, you know, and comfortably like stretch back again, you know, it's that reversing that forward flex position that they're, you know, that everyone's constantly in. So doing that back extension stretch is also very important. And sometimes what I'll do is I'll even have the resident hold on to the walker, and I just have them, basically, I'll even say, just look up, just look up. And what that does is that will turn on those back extensors. We've also got a trunk flexion stretch. This can be done in sitting, very easy to do, you know, just kind of stretching. And again, I do these exercises all the time because I get stiff and sore. And then we have like, you know, a resident, if they're lying in bed, they can do, this is what I call like a lower body or lower trunk rotation stretch, just rocking their knees side to side, stretching out their trunk. Hamstrings are also really important. So I put 2 hamstring stretches, you know, which one is that? Like one in sitting and one lying down, you know, and which the, you know, staff can also assist with as well. Pec stretches. Again, if one of your residents, if they're unable to like stand up and stretch, I mean, just even like bringing their arms back like this, stretching out those pectoralis muscles. Again, when we're in this position like this, we tend to get stuck in this position. So we want to just open up that chest. So you guys have these exercises. I also sent over modified exercises as well, like for residents who aren't as mobile. So I hope that you guys will be able to, you know, utilize, you know, these, you know, as a reference, you know, when you are working with your residents. Okay, well, last slide. Just some additional recommendations. Again, we've already talked about, you know, it's okay, you know, to do exercises in bouts of 10 minutes. You know, it's okay to modify standing exercises, you know, if you feel like that resident is unsafe. But again, utilize the physical therapists that come to the home. We are educators, so they will help you. You know, they will make sure that, you know, that the exercises that they're giving you, you know, are safe and effective for that resident. And lastly, best to be proactive rather than reactive. So if you are noticing that your residents, they're having a harder time with walking, they're having a harder time with sit to stand, call the doctor, call the nurse, you know, have them, you know, get an order for physical therapy. I would much rather go in and work with a resident, you know, to work on strength, to work on balance reactions, like right when they're starting, like where it's like, oh yeah, I can see that, you know, they're having a harder time with their sit to stands, or they're having a harder time with walking. I would much rather work with them before a fall than after a fall. So thank you, everybody. I really appreciate you, listening to my in-service on maintaining function and maximizing function. And I hope you guys got some good information out of this. So thank you very much.
Mahalo, Susie. We appreciate your wisdom and knowledge that you've shared with us all today. Very practical tips on getting our residents to goal and achieving their recovery goals. Thank you very much. We can open the chat and open the floor up for questions. Please don't be shy. You can unmute yourself and ask a question. Anyone wants to share a case?
I want to see who has done fun exercises, who has had great ideas for having fun exercises. Anybody?
So is everybody, the participants in this presentation or this for this hour, they're all with small care homes? Is it small care homes and foster homes?
Well, this is one at Gaylord, and yes, our homes are licensed for 5 or less residents.
Okay.
I know the majority of my members that are on this call, the care homes are licensed for 5 or less.
Oh, okay. And I've been to many of, many care homes, the 5 or less care homes. And some of the other things that I see that I just love when I go into the care homes, like I love watching after lunch or something, that you have one of the residents, they help bring the dishes into the kitchen, or it's just so neat to see them interacting, and that's the wonderful part of these small care homes, is it really is like a family. And to see the residents still being able to get up and interact and move around and help with the dishes, or go with the staff to go get mail, or go to Long's. I just love that. I love when I see that in the care homes.
Thank you, Susie. I was going to share, I learned so much from your talk. From your previous presentation, I learned that the most important exercise is sit to stand.
Yes.
And I said, oh, I didn't know that. And I have my parents visiting from India, and my dad had a stroke 2 years ago.
Mm-hmm.
So they do exercise every morning. And I told my dad, please do your sit to stand. And he said, I did 4 today, but I could do 40 a year ago. I said, you could do 40? You got to bump up your numbers now. So every morning, every morning I make them do more.
Yep. And they actually, you'll be surprised, residents and elderly folks, they can do more than what you think. So sit to stand really does help, really helps me gauge, I'm okay, let's see how, how much I can really push them. And a lot of times I will do, I start out with 5, and then we work up to 10. And, and then also what I'm looking at, when they're doing sit to stand, I'm okay, how much do they need to use their arms? How do they lock their legs, into the chair, as they're going from sit to stand? That will tell you a lot about their balance and their strength as well. So the goal is really okay, you want to sit at the edge of your chair, and you want to it's hard, you can't really see me, but it's, sit at the edge of the chair, feet slightly under you, nose over your toes, and you really want, so mechanically, you just want to be in that better position. And it's okay if they have to always hold on, if they have to push off or like hold on to a bar or something stable. It's okay for them to do that. But what I like to see is like, okay, well, what can they do and what can't they do, starting out. And I always do, I work them. I mean, a lot of times my patients, I have them do 2 sets of 10 sit to stands, and they can do it.
Wonderful. Thank you for sharing that and the correct technique. Appreciate the demonstration.
I tried.
Thank you for the beautiful video. We all enjoyed the drumming video, so creative, and it was just a joy to see the seniors drumming away.
Yeah, and those I was hesitant about putting that video on because it is a lot younger participants, but I have seen it. I've seen it in a lot of the ALFs and some of the care homes. They are doing it, with older folks. So, and you saw how they turn the chairs upside down. So you don't need a lot of fancy stuff. Like even at the care homes, like go to Ross and, you can get those Swiss balls for like $5.99. Tip a chair over, or get like, you can go to Home Depot and just get those 5-gallon buckets and or even a laundry basket, and you put the ball in the laundry basket, and get some drums, and they love it. And it's very easy to do. So you can do it with a 80 to 100-year-old residents. They love it.
Thank you for sharing that. We'll all go to Ross today.
Yes, Ross is a great place. That is a great place to get exercise equipment.
Awesome. Thank you for sharing. Any questions from the caregivers and care home operators, foster home operators?
Keep thinking about it. In the meantime, I'm going to ask John to put the slides back up for the evaluation part. Hey, John, if we could have the slide with towards slide 40, actually. Go to slide 40. So starting this month, we would like you to share with our team how many people you screened for sit to stand, how many people in your care home you screened for the timed get up and go, and how many falls happened in the past month. If you recall our very first session last month, we had some little videos to demonstrate how to do sit to stand and the time to get up and go test. And so I would encourage you to go back and to review those videos. You can just go back to the website and rerun them and take a look. And I think that, and the other thing is, it's actually good for exercise as well, like the sit to stand. And I'll tell you, some people get really competitive. I tell patients to do 5, and then they're very proud of themselves. And they say, I can do 10. And then the next time I see them, I can do 15. And they kind of get very happy about their accomplishments. So I would encourage you to do that. So you will receive a link to fill out the online survey to share how many of your residents have these 3 documents. And please try to have someone screen all of your residents before our next session. That would be really great. And if you try to complete this, it will help us demonstrate that you are doing a good job helping our residents achieve their wishes and reducing falls. So yeah, so you can do this as a test, as a screen. You can do this as an exercise too. And if they improve their scores, I guess they'll just be happy. So yeah, and next slide. And if you need any help, we have evaluations are emailed out using an automatic system. So please double check the spelling of your name and email address. Otherwise, we might not receive it. So thank you, Michaela. She's available on Monday at 2 p.m. To do office hours in case you have any questions. Any other comments, Michaela?
Thank you, everybody, for all of the time that you've spent completing these evaluations. They really do help us, and I know that they take a little bit of time. Please double check your spelling of your name. Make sure that you have capitals in the right spots, and double check your email. Sometimes certificates of attendance do not reach you because they bounce back. The email address hasn't been written down correctly. So if you could double check those before you hit submit, that really helps us. Otherwise, if you have any questions, you can email me or John at any time. And we want to thank you for your participation.
All right. Hope you guys are all inspired. Thank you for sharing.
Thank you.
Thank you so much. Have a great day.
Bye-bye. Thank you.